Hi class, my name is Jessica Waldman and I'm going to talk about telepsychiatry and how it reduces hospital admissions. First, a little background about mental health within the United States. 1 in 5 adult Americans is living with a mental health issue. People with mental health conditions are at a significantly higher risk for other health problems such as substance abuse. They also tend to be uninsured and have lower incomes. With the Affordable Care Act in 2010, the use of specialty services such as mental health has increased dramatically. In 2016, 56.8 million visits to a primary care provider and 4.8 million visits to an ED were all for mental health crises. Despite this increase, mental health providers' accessibility and availability remains low due to the number of providers that we have. In 2018, there were only a little over 30,000 practicing psychiatrists within the US, averaging about 9 physicians for 100,000 people. Research has shown that we need at least 15 per 100,000 in the population to provide good mental health. It's also estimated that 60% of US counties lack a psychiatrist entirely, and most rural areas are among those affected. We also have the aging workforce of our psychiatrists, whereas 59% of the population is 55 and above. We also have less emerging students going into the field. All of this leaves us with severe delays in outpatient treatment due to this shortage. It also reduces the quality of the treatment received. With also the rural areas lacking providers, we have patients that have no way of getting in touch with the provider. It leaves the psychiatric crises being handled by emergency departments, by untrained general practitioners or physicians in mental health. It often results in unnecessary inpatient admissions due to the fear of liability. It also leaves us with suboptimal care and poor patient outcomes. Many of these patients end up boarding in an ED while they wait for an open inpatient psychiatric bed to become available. And it also strains the resources and overcrowded EDs. Telepsychiatry has long been proposed as a method for increasing access to a psychiatrist. We're hoping that it would decrease admissions and unnecessary transfers, and that it would provide education to our general practitioners and increase collaboration in the inpatient and outpatient for mental health care. Overall, improved outcomes for patients should happen. My PICO question, we're going to be looking at adult patients over 18 years of age who receive a telemedicine visit versus a standard treatment and see how it affects the hospital admission rates. In conducting a literature search, I first completed the Google Scholar search to do a general overview and see what keywords trigger the most pertinent data. Then I moved on to PubMed, CINAHL, and the Web of Science databases, utilizing both a quick and advanced search. As here, you can see that my inclusion criteria had to be 5 years old, the adult population, and written in English. The first 2 studies were both clinical trials, one being a single-armed and the other a randomized controlled trial. Both evaluated either a telehealth device or a virtual navigation program, which was sent home or follow up with post-ED patients. Some included daily calls and some included weekly in-person calls. Both showed to have a decrease in readmission to the hospital, one over 6 months, the other in 45 days. 2 other studies were matched cohort studies, evaluating both the time to a provider, transfers, and hospital admission rates. As you can see, both decreased wait time to a provider and decreased transfers. The only thing is they had higher admission rates in the critical access hospital due to only self-harm diagnoses being included in the study. One final study included was a qualitative one that evaluated a rural telepsychiatry program in Australia. We evaluated these 6 aspects to see what the providers felt. Most physicians who use this program felt that the patients received the correct treatment, had improved access to care, and that it supported the education of the providers, and also reduced the transfers and readmissions. Recommendations to help close this gap in mental health care is we need to fund rural access and critical access hospitals to allow for telemedicine implementation. We also need to lobby for increased reimbursement to give providers the push to enter psychiatry. We need to expand collaboration between inpatient and outpatient facilities to promote continuity of healthcare. We also need to increase awareness of telemedicine in the private sector because it's already used in the public sector, such as the VA system. Biggest thing is we need to decrease the stigma of receiving mental health care. So things we know, telepsychiatry works, decreases wait times, increases access, decreases overcrowding and cost, and hopefully we're going to reduce the stigma of mental health care. I'm just going to introduce you to my co-author who is part of this entire research program with me. Here are my references and my contact information should you have any questions. Thank you for taking the time to listen to this.